Yes, sir. Devi ma'am is here now.
Okay, great,
Okay.
great, great.
अनूप सर,
जी सर, जी सर।
ये चेयरपर्सन को चेयरपर्सन और स्पीकर ज्वाइन हो चुके हैं ना?
हाँ जी। हाँ हाँ,
चेयर, यस।
speaker is there.
ओके
Kailash sir
ओके
is
ओके
there,
ओके।
and chairperson.
सुरेश कुमार सर इज देयर, ओके सर।
No, speaker is Suresh Kumar sir is speaker.
यस यस, ही इज ज्वाइंड, यस,
Now Mahesh sir, what about
ही
Mahesh
हैज
sir?
ज्वाइंड।
Mahesh sir will join now.
So Mahesh sir will
ओके
join now. Okay, okay.
ओके,
Hello.
यस
Sir,
सर।
हाँ
tell me.
महेश sir.
Yes, sir. Tell me, sir.
Okay, okay. Thank you, sir. And we are just checking that you were joined in or not.
Yeah, I am from Karnataka staff.
हाँ जी, no, 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 sir. We'll start. No
Oh,
worries, sir. Wait. Kailash sir, Kailash sir.
Yes, sir. Yes, sir. I'm here.
Okay, thank you, sir. Thank you, sir. Okay, okay.
ओके सर, ओके। सो सोनिया मैडम।
Yes, sir, sir. You continue the session, sir.
Okay.
Yes, sir.
So, after the lunch break, in this first day of Attack on 2024, we are moving to the fourth session of day first. The topic of this session is Ortho in Ayurveda. The speaker, the speaker for this session is Dr. Suresh Kumar sir, uh, and the coordinators for this session are Dr. Devi madam and Dr. Anup M sir. Dr. Devi Madam is HOD and Associate Professor in Rog Nidan Department of Ayurvedic College, Coimbatore. And Dr. Anup M. Sir is Associate Professor in the Department of Kriya Sharir in National Institute of Ayurveda, Panchkula. I request both the coordinators to start the session.
Thank you, sir. Thank you so much. Over to Devi, ma'am. Let me start the session actually. Very good afternoon to everybody, respected dignitaries over there, and my dear colleagues. Today, we are very happy to conduct this uh, seminar or a conference. We are so happy to bring together many versatile speakers to spread our knowledge. And we are so happy that everybody had joined and shared their views and knowledge for the Ayurvedic fraternity. And we are so happy that Ayurveda Teachers Association had made this possible. So let me thank everybody for this proud movement and let the seminar continue yeah, in every session actually. And let me ask Dr. Devi Madam to introduce the chairperson and co-chairperson, please, ma'am.
Namaste all. So today, for our program, we have a person as Dr. Mahesh Chaudhary. Sir is the professor and HOD of Shalyatantra Department at Chaitanya Ayurveda College, Sakegaon, Maharashtra. Sir has many publications in Index Journal and he has attended many seminars and been resource person for many national and international conferences. Sir is the author for 4 books and has 2 patents in his name. Sir is also doing a lecture series on YouTube channel. I welcome you, sir. Now coming to the co-chairperson, Dr. Kailas Murlidhar Chopde, sir. Sir is currently the HOD of and professor, Department of Sadhya PG Institute of Ayurveda, Gujarat. Sir has postgraduated from Nagpur Government College and have an experience of more than 12 years as a faculty and also as a skillful surgeon. Sir has many publications in Index Journal and was a resource person for many national and international conferences. Sir is also a member at Board of Studies of Gujarat Ayurveda University. So I welcome you, sir.
Thank you,
Over to
madam.
Anu.
Thank you, madam.
Okay, thank you, Devi ma'am. Here I am going to introduce today's speaker, the versatile speaker, Professor Dr. C. Suresh Kumar Sir, MD and PhD in Ayurveda. He had took his PG from the very famous government Ayurveda College Trivandrum at early 90s, and his PhD from Sri Shankaracharya University. And about his skills about Ayurveda, orthology, and sports medicine is versatile and remarkable. And he had presented all around 138 papers in both national and international level of presentations. And he had bagged many awards like Mahadhanvantari Award, Vishak Pratibha Award, Vamsha Vaidya Award. Okay? And he is a guru of Guru Sishya Parambara, where RIB is conducting the Guru Sishya Parambara. He is a versatile guru, and many of the people around India, around the globe, also coming and visiting him to take the knowledge around the globe. And he's advisor of Travancore Cochin Medical Council, and he's a PhD guide also in Sri Shankaracharya Universities. And he had worked for many ICMR projects, and he, as a medical consultant, he is a managing partner and chief physician in Triveni Nursing Home, which is a famous, one of the famous nursing home at Trivandrum, which is the capital of Kerala. And he has also many it has also many sister concern like Triveni Pharmaceuticals at Trivandrum, Triveni Nursing Home at Ernakulam, Triveni Nursing Home, another branch at Chennai, and many other sister concerns are there. And he is having a splendid knowledge about this sports medicine as well as ortho, and his history of treating patients is miraculous. And I welcome you, sir, for this session, for conducting the session on ortho in Ayurveda. Please, sir, please shower your light over Ayurveda and please enlighten us.
Good afternoon. Thank you for those good words. Am I audible?
Thank you, sir. Yes, sir. Sure, sure.
Can I share the screen?
Sure, sir. Sure.
Is it visible now?
Yes, sir. It's visible.
Yeah. Yes, sir. Okay. And today is New Year for Kerala. And it's raining heavily here in Trivandrum. And the first slide I'm going to show you is, it's 1 hour, no?
Yes, sir. It's 1 hour. 1 hour session, sir. Please.
The first slide I'm going to show you is the lady who came yesterday night 2 p.m. And I was in my home, and today's New Year, so I thought of going to temple early morning. Then one of my juniors told me, sir, a lady has come and she is unable to move its limb. Then I told, why not to take an X-ray? And on the left side, you can see the fracture. See, can you ever imagine a patient of a fracture of this can visit an Ayurvedic doctor? This is the strength of Ayurveda. In Trivandrum, in Kerala, in Trivandrum at least, the first choice for orthopedic management in common people is our hospital. So the aim of this class is to make you equipped to have a center like this anywhere, wherever you practice, and to make you confident enough to take this essay to everybody. So that is why I have today morning. This is the first slide which I today morning 2 o'clock, early morning 2 o'clock. This patient came to me, and we are managing it also. And this is my father. He happened to be the professor of Shalyatandra in Trivandrum Ayurveda College, and after his retirement, he became a honorary consultant in Government Ayurveda College in PG Center, and whatever I am is because of him, and also a group of teachers like you all know Dr. P.K. Mohanlal, Dr. G.S. Raju, so many people too. Dr. Singandan. Most of them are no more. But every day we used to pray, and that is how my life starts. And this is the first slide. Orthopedics in Ayurveda is so well developed that nothing needs to be added or deleted from the text even now. I'll repeat this once again. Orthopedics in Ayurveda is so well developed that nothing needs to be added or deleted from the text even now. A new person, after learning Ayurveda, if somebody says like that, come on, you are bullshitting this. But end of the class, you ask me what is lacking in orthopedics as per Sushruta. No wonder why Sushruta is said to be the father of surgery. The concepts are seamlessly documented without the help of X-rays or other modern diagnostic gadgets through extensive cadaver dissection. See, during that time, he never had an X-ray. He never had an CT scan. Everything he has documented with extensive cadaver dissection. That is why I always dedicate this session to Sushruta, the father of surgery. And the quote I have down in the down is what Newton has told. If I have seen further, it is by standing on the shoulders of giants. Whatever he has discovered is only after standing from the knowledge he received before. Similarly, what I am going to say is whatever the knowledge I got from Sushruta. That is, I always dedicate this session to Acharya Sushruta. Earlier, there are two types of people who are practicing. That means some people said marmani. Marma you all know. Marmani. Marmani is the person who practice marma. And they usually used to practice Bhagna Jilsa also. Here I'm going to show you a session by one of the famous film of you can see here. Tell me which marma is this? You can quote it in the chat box. Second edition has come right now. You all know Kamal Hassan's India. Here, those who are Malayali, they can see there's another marma here. And this person had a traumatic quadriplegia after a road traffic accident and he's laid down and he's under my treatment even today. This film star. And now I'm going to show you a slide showing that we need conservative orthopedics. This lady had a fall. She underwent operative reduction and internal fixation 2 months back. After 2 months, she developed fits and then she had yet another fall. And now you can see on the left side, the whole thing has been totally broken once again. Now you imagine what the doctor has to do. He has to tear open the whole area, remove the plates, and then redo it. You should always think that the screws where it's already placed, you cannot place another screw over there. Now he has to or she has to go for either some other method or conservative management. Now the whole world is turning into conservative orthopedics. This is why I have kept this slide here. Here you can see a watchman by profession. He had a road traffic accident, had multiple fractures, and he got the whole limb infected. And he was not walking for the last 1.5 years. You can see here, if you closely watch, you can see there is a false joint there. Here, you can see another what's nice shoulder joint dislocation, recurrent shoulder joint dislocation, where the patient underwent an operation called putti plates operation. After putti plates operation, he was totally unable to move his limb. And what you can see is after 3 weeks of treatment, he is able to move his hand up. Can you see this? Yes. This is the medical record of what he has done. And what is Sushruta say regarding this? Sandhim Shira Vimuktamstu Snigdhan Swinnan Mridugdan Uktair Vidhaner Buddhyacha Samyak Pragati Mane. That is what I have done. When it is a recurrent shoulder joint and dislocation, we have to do Snehana, Svedana. After making it into soft, then we have to do the proper treatment. That is what we have done, and he is able to move his hand. So, whatever treatment I am showing here is as per the text, and nothing has come from my own innovation. Nothing. So, if I can do it, you should be able to do it. That is the aim of this class. You can see some unique cases. You can see it is a 3-part fracture. Can you see it here? And this is the type of treatment we have done. You can see on the left side, you can see how easily we will be able to reduce a shoulder joint dislocation. If I am doing it offline, I'll be able to teach you how to reduce a shoulder joint dislocation at your clinic. You can see here, the patient is made to lie down. As simple as that. This is how we are able to, I'll teach you. Here, there is another different types of fractures. And this is another Schatzker's type, grade 5 type of fracture. Can you see there is a fracture over the tibial plateau, lateral plateau. And patient, last week I was in Chennai, I was in Cochin. A similar patient came, he underwent surgery and is almost 8 months now because he did it in the month of January. Now it is August. And 8 months now, he is unable to walk. Here, after 40 days of treatment, you can see the improvement.
After 41 days. The photo.
You can see him walking after 6 days. And you see, we don't use even paracetamol in a hospital. No painkillers. All properly with Marma Chilsa. That is how. Then, here you can see that a fracture of humerus shaft. And after, it is right now undergoing the treatment. You can see here. Can you see there's a humerus shaft fracture? And this is also first week after reduction. Then yesterday or day before yesterday, she came and she was able to lift her hand up. Can you see here? This is after healing. And here is another bimalleolar fracture. And after reduction, this is how it has been done. You can see how it is being reduced. See, bimalleolar fracture, you can see here. And then after reduction, and you can see him walking. This is the traumatic area. Now I'm talking about disc. I have around 300 patients before and after MRI of a disc, intervertebral disc prolapse. And I'm showing you one among them. You can see a largely migrated, superiorly migrated left posterolateral disc extrusion in L5-S1 level. That is what it is being told here. After 3 weeks of treatment, I have taken an MRI. And he says that previous MRI dated 9/1/2012 was available for comparison. The previously seen large superiorly migrated herniation at L5-S1 level is not seen in the present study. Like that, we have around 300 to 400 patients before and after treatment. And here you can see Pullela Gopichand, who was here for this treatment for this tennis elbow, and recently he came for this neck pain, etc. Now I'm going to show you another interesting case here. Is an MRI of right knee. On the right side of your screen, you can see there is a lateral collateral ligament tear, medial collateral ligament tear, anterior cruciate ligament tear, and below down, you can see there is a lateral meniscus tear. So almost all the ligaments have been torn except the posterior cruciate ligament. This we term it as terrible triad or unhappy triad. After 3 weeks of treatment, you can see him walking. My students were asking, "Sir, will he be able to walk?" And after that, you can see him walking. So these are all the strength of Ayurveda, which I always tell my students, we should be able to do as means if I can do it, you should also be able to do that. So end of the class, you can ask all questions, whatever it is in your mind, I'll be able to clear it. Now, earlier, the common people had enough knowledge about Marma Chilsa. And just like you are wearing a bindi, or you can see in God's photos in your room, where you can see certain areas have been covered. These are all Marma areas. And as I was telling you, 3 people were practicing Marma Chikitsa. One is Ayurveda community, like us. Second is martial art community. And third is Tamil Marma. All these people were practicing Marma for different purpose. The main purpose of us, our Ayurveda community, practicing Marma Chikitsa is to avoid surgery to be done on that side. Tasmal Marmasadanam Parivarjaneyam. Please don't tamper those areas while doing surgery. That is why no treatment has been told in Ayurveda regarding Marma. Coming to Tamil, they consider Agastya as the repository of the knowledge, and Agastya has 18 students, and all these 18 Shishyas wrote 18 books, each one book each, and all these books are available. Even one book is more than enough for our lifetime knowledge. We have 18 books available and different types of kattumara, that means bandaging techniques, different types of elakumara, that means manipulations, etc., has been told in detail. So that is Tamil Marma. In coming to martial art community, they consider Hanuman as their repository of knowledge. From Hanuman, Parshurama, from there, according to myth, what they say is Kerala was born when Parshurama threw his battle towards the sea near Kanyakumari to Gokarna. Land has receded, and that is Kerala. Parshurama brought 64 people from the north and gave 64 areas all over Kerala, and they developed this Kalari Marma Chikitsa. That is what the myth or Purana says. According to Ayurveda, it comes under Adi Devika and Sanghada Velapravutta. I am not going into details about Ayurvedic Marma Chikitsa because it doesn't have much knowledge except these are the areas. But The other marmas are seen in various other texts, which I'll give you a bird's view. So wherever there is pain, that is known as marma, as per Ayurveda. Coming to Tamil, as I told you, Agastya had 18 disciples, and he wrote they wrote different tantras. And see, if you go to Kerala, any temples in Kerala, that deity is getting more power due to daily puja that is going on. But coming to Tamil Nadu, the puja is not very. Coming to Tamil Nadu, puja is not that much prevalent. The deity get power because of the people who had samadhi. That means in Agastya had samadhi in Trivandrum and where Padmanabha Swami temple has formed. Bhogar is under Shishya of Agastya and he had samadhi in Palani where Palani Dandayudapani Swami temple is there. Sundaranadar in Madurai, Tirumular in Kumbakonam. All these areas where the Siddha had samadhi, big temples have formed, and that is how powerful these temples are. As I've told you, they are written in a combination of Tamil and Malayalam, and they are in poetic verse. Just like we have Sutasthana, Nidhanasthana, etc., they too have Sutasthana, Nidhanasthana, and they consider 108 points all over the body as marma. According to Ayurveda, we have 107, but Tamil have 108. How they divide it is divided into Padu Marma and Todu Marma. There are big or very important 12 Padu Marma, and each Padu Marma has 8 satellite Marma, and 8 into 12 will give you 96. Total 108. I hope you understood. See, there is one Marma here, and there are 8 satellite Marma in and around this. Like that, there are 12 main marma and into 8 total 96 marma. Sorry, 108 marma. That is how it is being told. These are the texts available with me. I have all these texts and this marma, wherever a book on marma is available, I used to collect and keep it. So all these texts I do have with me here. Then coming to Kulayana marma. Kulayana marma means martial art. They consider 64 marmas as marma, and the main aim of this is to give maximum possible injury to your opponent and also to guide or to make yourself free from getting injured. That is why the main aim of Kulayana Marma. So I have told you 3 people who are practicing Marma. In Ayurveda, the main aim is to avoid surgery being done. In Tamil, as I told you, Agastya, etc. And for coming to martial art, they consider to give maximum possible injury to your opponent and to get away from getting injured. So the treatment aspect of this Kulayana Marma is so good that we, in our hospital, we even practice some of this even today. Here, Kalari means school, a place where you learn. That is where Kalari, and this is how Kalari Chikitsa has come. Chikitsa means treatment. They consider 64 points, hand 12, legs 10, abdomen 3, chest 12, back and side 7, neck 7, head 13, altogether 64. And they consider Pancha Tattva. Pancha Tattva means a person who has a knowledge on Marma Chikitsa, he should have a perfect knowledge on Marma. He should know the exact place of Marma and then Prayoga. Prayoga means, see, you are in a game, wherever, you get injured. The first thing you are doing is Prayoga, where you'll go to that place, give small tapping to some other place, Marudatta, etc., and then make him almost all right and continue his for some more time. And then he is brought to your hospital and Pratibidhi is done, and later on we do Chikitsa. This is known as Panchatattvam. This is the concept even in sports medicine we follow. Once you have an injury, the first thing is you go and do Prayogam, and then you do proper treatment, and then yearly treatment is Chikitsa. This is a concept that is followed by Marmajiksa. This is another interesting concept. Whatever the type of trauma or injury you have to undergo 7 days Kshirapaga. That means first day you give Kshirapaga with Lejjalu, Mimosa pudica. Second day Prishnabarni, Desmodium gangeticum. Third day Vasha, Adathoda vasica. Fourth day Shalabarni, Pseudo artrica. Then fifth day Apamarga, Acuranthus aspera. Day 6 Vilva, Eagle marmelos. Day 7 Kashmiri, Melina arborea. Even now, we are doing this. A person coming with an injury, even with a head injury, 7 days, we have to give this Kshirapaga to relieve from all type of trauma-related injuries. That is known as Saptaha Chilsa. Then comes Matra. Matra means each and every marma, they consider the amount of force needed to stimulate, injure, or that is known as matra. I'll tell you, matra means it is defined as a force needed by a person who stands half a meter away from a banana tree and try to immerse this much of a body part. I don't know whether you can see my hand towards the banana stem. The force needed is one matra. I'll explain you in some other way. See, here there is a marma called talakar. If you need 4 matra, means talakar 4 matra it is said, then if I am to teach my student, I should use only 1/4 of the matra to teach. If I want to treat for any injury, you should use half the total matra. If I want to injure, I should use full matra. If it is 4 matra in talakar, I should use only 1 matra for teaching you. I should use only 2 matra for treating you, and I should use the full matra to injure you. That is what matra is being told. Teaching involves 1/4 of the required matra, treating half the matra, and hurting involves full matra. And now we are going into detail about Bhagna Jilsa. See, all bones has a name in Sanskrit. For example, clavicle, akshagasti. I treat lot of medico-legal cases. So if at all the patient come and I have to give a certificate, then I will give only Ayurvedic term, akshagasti bhagna. Then I'll be called to the court because each and everything they go for court. Then ask the judge will ask, what is this fracture? Then I should say Akshagasti means clavicle fracture. Nowadays, almost all the judges in Kerala, they know the Sanskrit term. When they have written in the Akshagasti, radius, Behir Prakoshthasti Bhagana. This is how we give certificates. So all the nomenclatures are available in our text, and we are going into in more details. See, the word asti is developed from the root asukshebane. Asukshebane means the carnivorous animal, after eating the fleshy part, throws away the bony part. So during olden days, they used to see plenty of bones being thrown away in and around. That is why asukshebane, the word asti has come. And osteology is also developed from the word asti. It is not my this thing. Harnley in History of Medicine, he says that osteology is also developed from the word asti. As you all know, there are 2 types of bone. That means the compact part of the bone is known as cortex and the spongy part is known as medulla. Here you can see this is the compact part and this is the medulla is the spongy part. Ayurveda also says that the compact part of the bone is known as karkara and the spongy part is known as pelava. So you should see that Ayurveda in detail has been told like that. Then what is the word? How will you define bhagna? Bhanja amartane. That means there is a force outside and your bone is getting broken. And the same is almost similar modern definition. Loss of continuity in the substance of a bone is known as a fracture. It ranges from a small hairline fracture to the big comminuted fracture. Dislocation means it's a complete and persistent loss of congruity between the articulating surface of a bone. And then sprain means Nadi Chinnam, Nadi Bhinnam, Ubhedo Lakshananidam, Vishamam Ranam Angeyata, Kshadam to Abhinadishe. If you have sprained your ankle joint, so what you write is Gulba Sandikshadam. That is how I usually used to write. Then there are bones are classified into Kapala, Rujaka, Taruna, Valaya, and Nalaga. Why Acharya has told different types of bones? Because all type of bones shows different types of injuries. Tarunastini namyande, bhajyandi nalaganitu, kapalani vidyande. My MD thesis was on nalagasti bhagna, long bone fractures. That is why different types of bones have been told. Now we are coming to joint. Tell me, you all know, we have learned in anatomy, Kora, Urukala, Samudka, Pradara, Tunna, Sevini, Vaisatunda, Shankavarta. So, all ball and socket joint is known as Urukala. Can you tell me how many ball and sockets joint are there in our body? You can write it in the chat box, please. I'll give you 1 minute time. How many ball and socket joints are there in our body?
काय बॉल अँड सॉकेट जॉईंट किती बॉडीमध्ये कानातले 2 आहे याच्यात आता पायाचे.
Please write in the chat box. It can be 1, 2, 3, or 4. See, there are 4 ball and socket joint. You all will say that it can be 2 shoulder joint and 2 hip joint. It is wrong. I'll tell you. That's why I have written this, which is shoulder joint, hip joint. In the ear, we have incudostepidal joint.
Yes,
and in the limb, we have lower limb, we have talocalcaneal joint. These are the 4 types of joints. Coming to more detail, modern orthopedics have 2 sessions. One is traumatology and orthopedics. Ayurveda also has Bhagna Chikitsa and Marma Chikitsa. All trauma-related comes under Bhagna Chikitsa, and others are cold orthopedics, comes under low back ache, etc. comes under Marma Chikitsa. Then fractures are, injuries are divided into Kanda Bhagna and Sandhi Bhagna, fractures and dislocation. Another classification which you all ask is whether it is a open wound or a closed wound. Savrana Bhagna and Avrana Bhagna. If there is open, it is known as compound fracture or Savrana Bhagna. If it is simple, it is known as Avrana Bhagna. Now coming to Nidana. Padana Pidana Prahara Akshevana Vyalamrikadashana Prabhutibet Anega Vidya Rasnam Bhagnam Vadishanti. Can you see here why Acharya has told different types of Nidana? He would have told any injury lead to fracture because each and every injury, the fracture differs. The X-ray that I shown here, you can see there is a fracture in the 5th metacarpal. And this happens only if you try hitting somebody with a closed fist. That is why I have kept like this. So Padana means fall, Pidana means compression, Prahara violence, Dashana or bite from different wild animals, and different types of injuries can lead to fractures. Then, what is the Samanya Lakshana of Sandhi Moksha? Prasarana Agunjana Vivartana Akshebana Ashakti Ugra Rujattam Sparsha Sagatvam Chedi Samanya Sandhi Mukta Lakshana. Inability to perform any activities like extension, flexion, rotation, vigorous movements, etc. And also severe pain, and there is severe tenderness. That is how we will consider this as a Samanya Sandhi Mukta Lakshana. So, there are 6 types of they are Utpishta, Vishishta, Vivartida, Avakshipta, Adikshipta, Tijakshana. No time. Utpishta means there is Vaisheshikam tu Utpishte, Sandha Ubheda Shobho, Vedana Pradurbhava. That means there will be a different types of swelling and swelling, different kind of pain, and you can see there is a swelling on the both sides of the joint. It is known as fracture dislocation, utpishtam. Vishlishtam, you all know, hemiplegic patient comes to your clinic with a drooping of the shoulder joint. It is known as subluxation or Vishlishta type of dislocation. Vishlishte shobho vedana sadhatyam sandhi vikriyacha. Then vivartidam. Vivartidam means medial displacement. That means a joint has been displaced medially. I will explain you with the shoulder joint dislocation. In shoulder joint, we have three types of dislocation. It can go anterior, it can go posterior, it can go inferior. A patient coming to your clinic with the hand held towards the body is usually anterior type of dislocation. A patient coming to your clinic with the hand held away from the body is usually posterior. If the hand is held over the top of the head, it is known as inferior. So it all depends upon the attitude of the patient comes to your clinic. So vivartidam is medial displacement. Avakshiptam means inferior displacement. Then what happened? The patient keeps the hand over the top of the head. Then Adhiktam means there is overriding of joint, telescoping of the joint. Adhikshipte dayo sandhyo adhikrandada vedanacha. That means there is overriding of the joint. We have learned medial displacement. Now what is left is lateral displacement. Tiryakshipte tu egasti parsha apagamanat atyartha vedana chedi. That means lateral displacement. So we have learned 6 types of displacement: medial, lateral, inferior, overriding, subluxation, and then fracture dislocation. All this has been properly learned now. Then we will explain you how to see a shoulder joint dislocation. Anterior dislocation, you can see the humeral head is most prominently seen in an X-ray. Coming to posterior dislocation, you can see a lighted bulb appearance. Inferior joint dislocation, you can see it is inferiorly displaced. How will you reduce the dislocation? See, the patient is made to lie down. Hand is held over the top of the head. After reaching the top of the head, you have to rotate internally and then give a small pressure in the shoulder joint. You can see how it has been done. See, very simply we'll be able to reduce it. And I tell you, in a hospital, we don't use even a paracetamol. We used to manipulate with Marma Chilsa alone. Here is what we have learned, but I have never even done, even once in my lifetime, to reduce a shoulder joint with Kocher's method. This is what we have been taught. And this is another method. And here you can see the patient is made to lie. You can see there is a dislocation. Patient is made to lie down. After keep bringing the hand over the top of the head, you have to internally rotate and then give a small pressure and bring back to normal. This is how it has been. And Swastika, you can see here, you just watch. I'm teaching one of my students. You should see here. You should see this is a marma here. Give a small pressure. This is how it has been done. What is the benefit of this? It can be done without an anesthesia. The patient can return home with it's less painful, etc. And this is shoulder joint dislocation. If you go like this, we won't be able to complete this. I'll show you this. This is as per Sushruta's technique. This is how it has been done. Patellar dislocation. I'll show you another patellar dislocation. You can see here. These are the 3 common dislocations that come to us. See, that is also been done. So now we have completed dislocations. We are going to fractures. ശ്വേതുബാഹുല്യം, സ്പന്ദന വിവർത്തന സ്പർശ സഹിഷ്ണുത്വം, അവപീഡ്യമാന ശബ്ദ, സ്രസ്താംഗത, വിവിധ വേദന പ്രാദുർഭാവ. These are the cardinal symptoms of a fracture. Sushruta has told long back, even now, we won't be able to get any other symptoms other than this. Massive swelling, tenderness, crepitus, loss of transmitted movement, different types of agonizing pain, and discomfort in all postures are the cardinal symptoms of a fracture. Here, this is Karkadaga. Karkadaga, you can see, Visheshastu Sammudam, Ubhedo Asti Madhye Bhatnam, Grandhi Rivondadam Karkadaga. Can you see here the Karkadaga type of, here you can see the fracture resemble like a crab. And then Ashwakarnavat Udgadam Ashwakarnam. Can you see here there is a fracture like this which resemble like Ashwakarna? This is known as spiral type of fracture. Chunidam communicates. Prishyamane Shabdavat Chunidam Avagadyade. That means there is a bag of bones. Then Pichidam Pradudangadam Analpashobam, compression fracture. And you can see Analpashobam. You can see swelling here, and then there is this is Pichida type of. Then Asti Chalidam. Asti Chalidam is subperiosteal fracture. Periosteum is intact, but there will be cortical tear inside the bone. That is known as subperiosteal fracture. Then Kandabhagnam, Melade, Pragambamanam, Kandabhagnam. See, all these X-rays are not being downloaded. These are our own X-rays. Then this is Majjanagadam. If I had time, I would have explained you in such a way that you will be able to understand what is this. Asti aveho, asti madhye anupravishya, majjanam unnahiri majjanagadam. That means there is a fracture and this fragment is getting impacted over this region. That is known as Majjanagadam. The patient might even walk into your clinic, but there will be she or he will be having pain. Usually it will be elderly ladies after menopause due to osteoporosis. Even a small injury can lead to Majjanagadam type of fracture. Adipadita, Asti Nisheshada Chinnam Adipadita. Then Abhugnam Avimukta. Usually seen in children. There will be green stick fractures or Vakram. Abhugnam Avimukta. Chinnam, Anyadara Parshavashishtam, Chinnam. Then Padidam, Anubahu Vidadidam. It is usually seen in flat bones or irregular bones, and fracture is seen here. Then Spudidam. Earlier, teeth were considered as bone. So Shuga Purnam Ivatmadam Vibulam Vispudam Spudidamidi. That means there will be a crack fracture in the teeth. That is known as Spudidam. And then you might be asking, what about pathological fractures? See, in different areas, Acharya has told Asti Vidradi, Asti Grandhi, Asti Kshaya, Majja Kshaya. In Hajita Samhita, Asbalida Asti has been told, which resembles like pathological fractures. I always tell my students, don't take all fractures because you have your own limitation. Even if you reduce it, even if you cannot maintain it, then there's no fun in doing it. So certain fractures, we won't be able to take it. We leave them for surgical intervention. One among them is intracapsular fracture. Because of the peculiar type of circulation you can see, it is means blood is supplied by lateral femoral artery and also the medial femoral artery, circumflex. So the circulation from this, the blood is going from the periphery towards the center. If at all there is a fracture over here, what happens? The fracture will heal, but the head will crumble away. So intracapsular fracture of femur neck should always be avoided and given for modern medicine for surgical treatment. And now a patient we have go for an X-ray. The patient comes with an X-ray. What will you do? We have to read it properly because the gold standard method for X-rays. We have each and every X-ray, we have certain protocols. For example, a spine X-ray, we have 13 points noted by reading the X-ray spine. First is the spinal deformity. You can see there is a scoliosis. Second is you can see the shape of the vertebra. You can see there is a wedge compression fracture over here. And I'm just talking about spine. Like that, we have protocol in all X-rays. And third is density of the vertebra. You can see here there is a dense vertebra. And number four, you guys should see intervertebral disc space. You can see this is normal. There is a erosion of joint space. Here is totally eroded. And then in transverse process, which we usually tend to forget, we can see there is a fracture over here. That is transverse process. And then spinous process, we can see here it is a spina bifida. And then sacrum, you can see it here. There is a fracture over here. Can you see here? There's a fracture over here. And then sacroiliac joint, you can see there is a sclerosed sacroiliac joint, indicating it is a sacroiliitis. Then paravertebral soft tissue, can see here, psoas muscle, cold abscess can occur. Pedicles are said to be, you can see the eye-like thing over here, P. It is said to be the eyes of the spine. If eyes are closed, always suspect it could be a cancer or major metastatic lesions, pedicles. Then we come to facet joint. You can see there is a Scotty dog shadow. I need time for you to explain that in oblique view. And then vertical diameter and sagittal diameters. These are the 13 things you should do for a spine X-rays. Now we know we have diagnosed a fracture, we are going for treatment. Bhagnasthapanam, Bhagnasthiriganam, and Punacheshta Prasam, reduction, retention, and rehabilitation. And you all know that earlier we say that plaster of Paris was found by our Matheson. But I tell you, in Ayurveda, it is told that Ado Bhagnam Viditwatu Sheje Chidalambuna Pangena Alebanam Kudyat. A Pangena Alebana. Panga means a type of clay, has been used in earlier days. After fracture is reduced, they tie it with a cloth filled with clay. That clay is later modified and became as plaster of Paris. Then we have to reduce it. There are 4 principles of treatment: Anjanam, Pedanam, Samkshebam, and Bandham. Anjana means traction, Pedana means manipulation, Samksheba means keeping in the position, and then bandages. So we use how to know that whether it is properly reduced or not. When the pain gets reduced, when the stiffness bit comes down, and you take and check X-ray and find out that it is properly reduced. These are the different types of splints that have been used. Madhuga, Udumbara, Ashwatha, Palasha, Kakupataja, Vamsha, Sabja, Varana. Nowadays, even today, we use bamboo splints for fractures. And these are the different types of latest techniques that have been used. And then we go for bandages. You keep 1 day session for bandages. We'll be able to teach you all this type of bandage. We need 1 day. That means Kosha, how to do Swastika, Muttoli, China, Dama, Anuvelidan, Katwa, Vibanda, Stagiga, Vidana, Ulsanga, Govana, Yamalam, Mandalak. These are the materials for bandages. And I'll show you one bandage done in a child. This you can see. Head. If it is an adult, it would have been much more easier. But he had a fall, and we took an CT and found that there is a small, you can see in the left side of the skin, subdural hematoma. We are putting an ointment, then we are putting a kavaliga, and then we do bandage. We'll complete it and come back so that if time allows, we'll show you that bandage. But otherwise, we don't have time. It's already 9 minutes only for completion. And these are different types of bandaging techniques. That's what I was telling you. You have to keep 1 day session for bandaging techniques. We'll be able to teach you what type of bandage, how to do, etc. Ankle joints. So, what are the duration of bandage? Saptahat, Saumeshu Rudushu Bandhanam, Sadharaneshu Kartavyam, Panjame Panjame. That means we usually used to do bandages every 3rd day for normal injuries, and for fractures every 7 days. Then it should not be too tight, it should not be too loose. A moderate bandage has been advised by Acharya. Then students will ask, sir, when is the time to remove the bandage? The fracture healed or not? So Acharya says, Bhagna Sandhi Manavidam, Ahinam Angam Anulbanam, Sukha Cheshta Prajaramcha. That means when the swelling has come down, when the stiffness has come down, and the patient can start moving the limb, that is the time for removing the bandage. It is usually 6 weeks for upper limb and 8 weeks for lower limb. But a thumbnail is usually what is your age, that much date you have to put bandage. If you are 30 years, then 30 days. If you are 60 years, 60 days bandage should be done. That is how we say. Then, if at all a fracture has been malunited, what should we do? We have to refracture. Acharya says, Kanda Bhakne Prarude to Vishama Ulpana Samhide Apothya. That means refracture. Samayed Bhagnam. Then you add, if you have time, I'll show you. This is a refracturing technique which we have done. I don't know we have time. And we will skip all the videos now, and we'll complete it. And if time allows, and if you tell, I will go towards that. This is a refracturing technique. Then, if it is an open wound, what to do? Kalpe nirgadam shushkam branande asti samayasa. We have to remove that and then properly bandage. And I have earlier, my father used to do all this. Nowadays, I don't take all these open wounds. Then, after reduction, after removing the bandage, what we do? We have to go for rehabilitation. Acharya has told, Mritpindam dhare purvam lavanam cha tataparam haste jada balam cha bhi kutyat pashanadam. That means he has asked us to take graded exercise. Small stones, gradually increase the size of the stone. When the hand got enough strength, then we go for normal this thing. And Ashtanga Sangra says, Pragome. Nowadays we go for wax treatment. Earlier it was Pragome. That means Gome, hot cow dung were used instead of wax. See, the amount of knowledge he had was something phenomenal. And we don't have to add even a single comma or full stop over the knowledge he had. Only thing that we lost that link. Then what is the prognosis? Alpashano, anatmado, vadatmarasya, upadraver vajustasya, bhagnam kircharena siddhi. That malnourished, lack of nourishment, diabetes or comorbidities, the prognosis is bad. Then, word of caution. Take every effort to prevent getting infected. Once the bones get infected, it is not that easy to cure. Bhagnam neiti yatha prayedeta tadhapishat. Pakwa mamsa sidasdai sadhikrtsena siddhati. Even now, with so much, and even a bone infection is not that easy to cure. Then people ask, sir, can I take Horlicks? Can I take Boost? What Acharya says, Shali mamsa rasakshiram sarpir yusham satinaja. Brahmanam channapanam se adeyam bhagnaya janata. That means all nourishing food can be given. What should be avoided? Lavanam kadagam ksharam amlam maidhanam adabam vyayamam nacha seveda. Avoid excessive use of salt, katurasa and namlarasa, excessive use of pungent food, etc. Exposure to sun, heat and vyayama. So these are the things. I think we have covered this. And if we have time, I'll be able to show you different types of fractures, how we set it. And over to you, sir. These are some of our x-rays. And this is a fracture that came in my student class, whether this boy will walk. On 30th day, you can see him walking. So, in conclusion, despite the lack of facilities like radiology, potent anesthetic drugs, antibiotics, analgesics, Ayurveda surgeons, especially Acharya Sushruta, has done tremendous work in the field of orthopedics and traumatology. It is a myth that Ayurvedic classics don't have elaborate explanation about skeletal injuries and trauma. Rather, the fact is that Ayurveda has a rich heritage of orthopedics and traumatology, which needs to be explored furthermore. Abadavarjanam nityam, swasthasya anuvartanam, utpannati vigadasya marmanam paripalanam. I thank you for your patience here. So in case if you are stuck somewhere with some type of fractures, etc., you can call me this time or in this number 9447160480. I'll be only happy to help you because orthopedics, spreading of knowledge of orthopedics all over India is my aim. That's why, in spite of so much busy schedule, I always find time to teach my students. Thank you. Thank you once again.
Thank you so much, sir. Thank you so much for your kind, enlightening, thought-provoking words. We are sorry to conclude you in 1 hour, actually. We would like to invite you for many other sessions in our to our conference. Sir, it is our pleasure to be with you in this conference, sir. Over to Dr. Devi, please.
Thank you, Dr. Anup. As my co-coordinator, Dr. Anup said, we are really blessed that we got a session from the versatile, great clinician and great teacher, Suresh sir of Triveni Nursing Home. Sir, there is varieties of ortho cases are managed there and is a center for where many young doctors blossom by training under sir. So being a busy doctor, many thanks for your valuable time, sir. We are really grateful for sharing your experience in a very interesting and expertise way for our audience. I believe young doctors will make use of the experience and aspiration shared by you, sir. I also take this opportunity to thank the chairperson, Dr. Mahesh Chaudhary sir, and co-chairperson, Dr. Kailas sir, for dedicating their time to support the event.
So I will please I will be interfering. I would
Yeah.
like to ask the chairperson and co-chairperson to share their views over this presentation, please.
Yes, definitely, Dr. Anup. Thank you. Uh, my opinion regarding this session, Dr. C. Suresh Kumar sir is very well elaborated with proper references and evidences that how the Ayurveda is also work in this sector. Definitely, orthopedic in Ayurveda is a topic have a great significance, unique and novelty. All these properties hold
Give
this
me
topic.
some one speaker in between.
This is a new area where the students of Ayurveda will work good
Children.
rather than the modern scholars. New therapeutic uses, techniques of Marma Chikitsa, very easy to digest. What method Dr. C. Suresh Kumar sir used to teach us? Color techniques and other method techniques, etc. There are many more corners still left unknown or where we have to work on this part of Ayurveda. Among of these, Suresh Kumar sir choose it and elaborated well. We are very pleased to have a like Dr. Suresh Kumar sir, very well illustrated musculoskeletal system with Marma Vigyan. Each and every minute point has well unfolded by him. Marmas have a great significance in not only the Shalya Chikitsa but also day-to-day practice. Sir has a very well himself developed to treat in this area. Ayurvedic orthopedics and Ayurvedic traumatology in these subjects, NCSM should start PG courses for becoming our PG doctors in Ayurveda for orthopedics practice. Finally, I conclude with this that C. Suresh Kumar sir is the father of Ayurvedic orthopedic and traumatology in Ayurveda. Thank you, sir, for enlighten and updating our knowledge about the orthopedic and traumatology in Ayurveda, and also thankful to Atacon for calling you for this session. Thank you. Hand over to
Thank
Dr.
you
Nu.
so much, sir. Thank you so much, sir. Dr. Kailas, sir, your opinion, please.
Yes, sir. Yes, sir. Actually, first of all, thank you, C. Suresh Kumar sir, for such a great session. एक्चुअली मैं भी मेरे क्लिनिक में यहाँ पे कॉलेज में ऑर्थो के केसेस आते हैं तो वहाँ पे मैं क्लोज रिडक्शन करता हूँ लेकिन कोलेस फ्रैक्चर में लेकिन सर ने जिस तरह से शोल्डर जॉइंट डिसलोकेशन का रिडक्शन बताया तो इट इज वेरी गुड तो अभी आगे से मैं भी ये ट्राई करूंगा और जैसे ऑर्थो इज अ सुपर स्पेशलिटी ब्रांच लेकिन सर ने एक आशा उत्पन्न की है कि आयुर्वेदा में भी सुपर स्पेशलिटी ब्रांच में काम हो सकता है तो मैं आशा करूंगा कि सर आप हमें उस बात पे हमें थोड़ा गाइडेंस दे दीजिए और हमेशा हमको ऐसे ही नॉलेज देते रहिए थैंक यू सर थैंक यू वेरी मच
Thank you so much, sir. Thank you so much for your kind words. Over to Dr. Devi. Please
As
conclude
our,
the session.
yeah, as our chairperson and co-chairperson suggested, like NCSM will come up with some syllabus and training. Now it is going to come for the final years to develop the Marma part, and the contribution of the Suresh sir also will be really helpful. So thank you so much, sir. As sir told, we have ready knowledge in our text, and it is to achieve success. It is our duty to develop the skill to develop that. So thank you, listeners, and also thanks to the my co-coordinator, Dr. Anu. Back to Anu.
Thank you so much. Thank you so much, Saxon. It was an immense pleasure to coordinate this session and to hear these valuable talks. And thanks to the entire team for conducting such a wonderful seminar and a conference. Over to Dr. Amar, sir, please.
Uh,
The session is
yes,
concluded.
yes, yes. Thanks a lot. Thanks a lot, able Suresh Kumar sir, for unfolding and enlightening your topic very beautifully with the evidences and demonstrations in a very simplified manner. We are very lucky to hear a great teacher like you, sir. So it was a beautiful session, and I also thank our chairperson and co-chairperson for their expert comments. I our coordinators, Dr. Anup M. sir and Dr. Devi ma'am, for very well conducting the session. So I conclude here. This session is